Now we'll see pin retained restorations. What are pin retained restorations? It is that any restoration which requires the placement of one or more pins in the dentin so as to provide adequate resistance and retention form to the restoration. If we see the indications for the pin amalgams, the complex situations like extensive tooth loss, cuspal damage, and the tooth which have a questionable prognosis with a grossly destroyed tooth and has a foundation for the indirect restorations like inlays and onlays or the crowns, or the age of the patient is also considered. As for the geriatric and debilitated patients, the pin amalgams are preferred choice over the cast restorations. So, if we see what are the contraindications for the pin amalgam, we have some occlusal problems, such as if suppose when the patient has significant occlusal problems, the pin retained restorations are not indicated. Cast restorations are suitable in the correct occlusal. And if you see the aesthetics, even in the anterior region, it's contraindicated. So it has to be avoided in the areas where the aesthetics are important. And the access difficulties in the posterior areas where access and the isolation for pin placement are difficult, the pins are contraindicated. Now see the classification of the pins. We have two. One is the direct or non-parallel, or another is the indirect or the parallel. Direct includes the cemented pins, friction locked pins, and the threaded pins. Whereas the indirect parallel pins we have cast gold pins, wrought pins. Now we'll see the cemented pins. So what are cemented pins here? That is the types of pins in that the Dr. Mills Markley, the cemented pins are developed in the large amalgam restorations. So these are made up of stainless steel with threads or serrations, which is having about the size of 0.018 inches to the 0.030 inches. And the pin channels here are the 0.020 inches to the 0.032. That is, the pin sizes are less pin sizes is less in size when compared to the pin channels. That's the reason they are luted with standard luting agents, and these are easy to place and they cause less internal stresses, but they are least retentive when compared to the other pins. Now we'll see the friction locked pins. In the friction locked pins, these have utilized about the resiliency of the dentin for the retention, and this was developed by Dr. Goldstein in 1966. And they are made up of stainless steel and they have the threads, and the pins are 0.001 inches larger than the pin channels. In these friction locked pins, they are tapped into the prepared channels with a mallet. Since they are larger than the pinholes, they utilize this resiliency of the dentin for retention. And these pins are 2 or 3 times more retentive when compared to the cemented pins, and they are used in the vital teeth for good access for ease of tapping the pins. But they cause increased internal stresses, which causes crease lines or the cracks. Now we'll see the self-threaded pins. The self-threaded pins were developed by Dr. Going in 1966. These are available as stainless steel or the titanium pins with the threads and may be gold-plated for increased passivity. If we see the pins are 0.0015 inches to 0.004 inch larger than the pin channels, and therefore they are retained by the elasticity of the dentin. The threads actively engage the dentin, providing the maximum retention among the different types of pins. The self-threaded pins also induce stresses in the dentin, resulting in the crazed lines. They are used in the vital teeth where enough dentin is available surrounding the pin. So, presently, the self-threaded pins are most popular type, while the cemented and the friction-locked pins are rarely used. So, there are several styles of the self-threaded pins. One popular variety is the thread-made system. So, this thread-made system is most popular variety of self-threaded pins presently available. In this, these pins are made up of either stainless steel or the titanium plated with the gold. They are available in the 4 different sizes. That is the minuta, mannequin, minim, and the regular size. So, as the sizes increases, the diameter of the pins are also increased. In this, the minim, mannequin, and the minuta are more commonly used because they cause less dentinal crazing. Now we will see the designs of the pin. In that we have 5 designs. One is a standard design in which the pins are of 7 mm longer but have the flattened head to fit into the hand wrench or the handpiece. After placement, this pin can be reversed to about 1/4 turn to reduce the dentinal stresses. Next is the self-sharing design. The self-sharing designs are the pins available in the various lengths according to the pin diameter. They also have the flattened head to fit into the handpiece. In the self-sharing, why it is called a self-sharing? Because the head automatically shears off after placing the pin into the pinhole. Now we will see the 2-in-1 design. This design consists of the 2 pins connected by a means of a joint which serves as a shear line for the peripheral pin. And they have the same diameter length. That is, the 2 pins are 9 mm long and the 2 pins provide each about 4 mm long. And next we will see the link series design. The link series design have the pins with a plastic sleeve that fits into the latch type contra-angled handpiece. And these pins also shears off after the pin engages into the into the dentin, and the plastic sleeve can be discarded. Now we'll see the link plus design. This design is similar to the link series design. These pins are also self-sharing and may be available as single or 2-in-1 pins. The major difference in this pin design is that the pins have a sharp threads and a tapered tip in order to reduce the dentin stresses while seating. Now we'll see the cavity preparation for the pin amalgam restorations. The complex restorations requiring the use of pins are indicated mostly for the class 2 cavities. So the pins are placed in few situations such as when one or more cusps are missing, or the cavity width exceeds 2/3 of the intercuspal distance, or when the tooth has a flat occlusal surface, when there is a need to increase the vertical height, or has a foundation for the cast restorations. So we have a few general principles for the cavity preparation for placement of the pin following the basic rules for amalgam cavity design. That is to remove all the carriers and the weakened tooth structure while conserving as much as sound tooth structure as possible. And initially we have to prepare the cavity by providing the dovetails, boxes and the grooves, and keep all the facial and the lingual walls as parallel as possible. And the margins should be preferably placed supragingivally whenever possible. And the areas to receive the pins should be always flat and perpendicular to the long axis of the tooth. And the weakened cusp should be reduced by 1.5 to 2 mm, and the occlusal contour of the reduced cusp should follow the normal contour of the unreduced cusp. And to start with, if you see, the teeth receiving the pins may be extensively damaged. So the cavity preparation in some areas, it is deep. So prior to the placement of the pins, we should take some measures to protect the pulp. Such as the deeper portions of the cavity which is close to the pulp will require a calcium hydroxide liner which may be covered with a GIC base. And now we'll check further some of the factors and the techniques which affect the pin placement. First and foremost is the pin size. In the threaded maze system, the minim and the minikin pins are usually the sizes which are selected for the posterior teeth because they provide the maximum retention without the risk of dentinal crazing or the perforation. And if you see the number of pins, how do you decide this tooth requires this many pins? So we have few factors which helps in deciding the number of pins to be placed in a given situation. That is the amount of tooth structure missing, amount of dentin available, the size of the pin, and the amount of the retention needed. So as far as possible, the fewer pins should be always preferred, and the rule is to place one pin for one missing axial line angle. This is because placing more pins can weaken both the tooth as well as the amalgam restorations. And now we'll see the location of the pins. For this, we should have the knowledge of the pulpal anatomy and the external tooth structure, and we should check the current radiograph, periodontal condition of the tooth, and the patient's age. And where these has to be placed? These are usually placed in the cervical 1/3 of the posteriors, nearly line angles of the tooth. And this should be 1 mm away from the DEJ or 1.5 mm away from the external surface of the tooth. The pin holes should be parallel to the adjacent external surface of the tooth. And the pin holes always located at 0.5 mm away from the vertical wall of the tooth. And if you see the interpin distance also, it should be 3 to 5 mm to the lowest stresses in the dentin. And according to the stress concentration, to reduce the stress concentration, they should be placed at different levels on the tooth. Now we'll see how these pinholes are prepared. Using the pilot hole or the dimple to accurately position the twist drill, with the help of a round burr, we used to prepare the pinholes. This prevents the crawling of the twist drills. The twist drills are used to prepare the pin channels in the dentin, and they are made up of a steel swagged onto the aluminum shank. We have two types of twist drills. One is a standard drill, another is a depth limiting drill. The standard drills have the length of 4 to 5 mm in order to limit the depth of the pin channel created by them. And we use a depth gauge here. And for the depth limiting drill, the depth limiting drills create a pin channel of about 2 mm depth into the dentin, and these are usually preferred. And these are attached to the contra-angle micromotor handpieces which run at a very low speed of 300 to 500 rpm. And the angulation, if you check for the twist drill, it should be parallel to the external contour of the tooth in order to prevent the perforation into the periodontal space. And after preparing the pinholes, now we have to insert the pins into the prepared channel using the two devices. One is the conventional handpiece micromotor, another is the TMS hand wrenches for the standard pins. Ideally, the pins should engage 2 mm of the dentin and project 2 mm into the amalgam restorations. If the pin length is longer than this, the excess length is cut off with other burr at a high speed which is perpendicular to the pin, so that it will prevent the pin from loosening from its channel. Another method is reducing the pin length is by using a pin bender such as the TMS bending tool to bend the pin and bring it within the levels of the restoration. So now we have seen how the pin is placed into the tooth structure. After that, the same procedure has like the amalgam preparation. In the now we have to place the matrix band around the tooth structure, and then insertion of the amalgam into it. That is, high copper amalgams are more preferred for the complex amalgam restorations because of its high compressive strength. And next you have to grossly remove the excess amalgam on the occlusal surface and develop the occlusal anatomy using the discoid carver. And remove the matrix band, then carve. After carving is completed, the restoration is finished and polished after 24 hours. Now we'll see the complications of the pin retain restorations. The failure of the pin retain restorations occurs at different locations. It may be within the restoration, that is at the restoration fracture. That is mainly because of the improper matricing or premature matrix removal. Another reason could be the high point in the restoration. Next one would be at pin and the restoration interface. This is caused by the corrosion products at the interface. Next is within the pin. It may be due to the improper technique during the pin placement. Next, failure may be within the dentin. This occurs due to the increased internal stresses and incorrect selection of the site for pin placement. Another is that at the pin and the dentin interface, that is, the pin pulls out along within the restoration. It may be due to the improper pin engagement of the dentin. Now, if you see the other complication, that is the broken drills or the broken pins. If suppose it happens, that is because of the twist drills may break if they are stressed laterally or allowed to stop rotating before removing them from the pinhole. And the loose pins occurs if the pinhole is larger than the self-threaded pins, then it may fail to engage the dentin. And the perforations may also occur by penetration into the pulp or externally into the periodontal space during the pin placement. Now we'll see the alternative means of providing retention for amalgam restorations. This helps in enhancing the retention of the amalgam. That includes the slots, that is, the retention grooves in a horizontal plane placed along the gingival floor just beyond the DEJ. These slots are especially useful in case of the short teeth. Next is the grooves. They are the retention locks placed in the vertical plane, and they are utilized when the sufficient crown height is present. And the copes are the undercuts placed in the occlusal portion of the complex amalgam restorations. And if you see what are amalgam pins, these are vertical posts of the amalgam anchored in the dentin. The concept of the amalgam pins was developed by Shavel in 1980 to allow the amalgam itself to serve as a retentive pin. This channel is prepared using an inverted cone bed on the gingival floor for about 0.5 mm within the DEJ, to a depth of 1 to 2 mm and the width of 0.5 to 1 mm. During restoration, the amalgam is directly condensed into the prepared channels using the fine pluggers or the small condensers. So, while planning the restoration of the badly broken down teeth with a vital pulp, several factors have to be borne in the mind. The prognosis of the involved teeth also plays an important role in the overall treatment and helps in deciding the restoration, when to be and what to be placed. So, Oh, and so that's the reason it is still an important that the dental student be aware of this treatment options to use it selectively. This is the brief about the dental amalgam and the pin retained restorations.